Around the world, there's a race for a COVID-19 vaccine. Sanitized spaces and clean surroundings are a matter of zero compromise today. Face masks, hand sanitizers, face shields are part of the new normal. And still, there's a lot more we need to do in large and closed spaces. And there's a need for better technology to prevent COVID-19. Corona Guard, powered by Shycocan, is a portable device meant to prevent coronavirus transmission in the enclosed spaces like offices, hospitals, schools and homes. The product is CE marked and is cleared by US FDA under the enforcement policy for sterilizers, disinfectant devices and air purifiers during the coronavirus disease 2019 public health emergency. This is how it operates. The Corona Guard operates on power supply to generate high tension at a switching frequency and delivers the necessary signals to a photon-mediated electronic emitters that produces hypercharged electrons that interact and disable the negative-seeking S protein of coronavirus, thus reducing the infectivity and prevent air and surface-borne transmission of corona family of viruses.
This is the first principle of this long time ago, which we thought about. And after that, we first tried to use this device for, containing the flu and cold and things like that. So that's how it started. And thereafter, the COVID came and the device was assessed and further modified, further improved to see that the right energy levels are maintained.
This innovative technology is intended to physically attenuate the homing mechanism on the virus and prevent infectivity. The emanated electron cloud actively disarms air and surface transmission of the corona family of viruses. The device can be safely deployed in all environments inhabited by people, be it very large or small enclosed spaces, that is, in hospitals, containment areas, quarantine areas, places where public meet. For example, shopping malls, schools, restaurants and offices, as well as homes. In short, we may be looking at a sanitizer backed by technology to keep our surroundings and neutralize the coronavirus.
Well, it's important, I feel, always to revisit the fight against COVID because it should never be that we get used to the increasing numbers and say, just let's live with it. So whenever I find something that seems technologically superior and which can provide us some kind of a technological guard against the transmission of the disease, I'm very interested. So Marzin is the Managing Director and CEO of Eureka Forbes, but I'd like to ask, and Dr. Anil Balani is a Senior Physician in Mumbai. But I'd like to ask Dr. RajaVijayKumar first, who's the man behind this new development. He's the Director and Chief Scientific Officer of the Center for Advanced Research and Development at Scalene Cybernetics Limited in Bangalore. Very proud of what you're doing, Dr. RajaKumar. I hope you can hear me. But tell me in simple terms, are you, in layman terms, would you say that I can switch on a device in a room, and even if two people who are carriers of corona sit with me in the same room, the disease will not be transmitted if this particular machine is switched on?
Yes, that is what the philosophy of the machine is, and I think I must have encountered myself at least four corona positive cases in the last 6 months in the vicinity of this device, and I don't know, we've been using this device for the last 1.5 years, and before even COVID came, and at least the last 6 months of the COVID, we've been living normal lives in our campus, and we don't have even a single positive yet.
But then, I mean, it's remarkable. How come we haven't known about it? you're saying, Dr. Kumar, that this device, which can stop COVID transmission, it sounds, it basically, viewers, what Dr. Raja, the problem with scientists is this, they make it sound so simple, and, but question is, if this device has been around in some way, why don't we know about it? And what is the applicable area? I'm sitting right now in a large studio, for example, Dr. RajaKumar, right? Say, let's say this is a 5,000 square feet studio I'm sitting in. How many devices do I need to put?
You will need 5 devices. Each device would take care of 1,000 square feet free area. So you may need 5 devices to protect your studio.
1 minute.
Okay.
So if I live in a house, suppose a viewer lives in a 3 BHK house, right? I presume 1 living, dining room and 3 bedrooms. You're saying that in you would need 4 devices for the 4 rooms of the house?
Yes, because the principle of the operation of this device, is to produce high energy photons that bounce off, the bulk materials or particles in the air and emanate, hypercharged.
No. So if someone sneezes, if a COVID positive patient sneezes in the room, right, and they're not wearing a mask, you're saying still, and I'm sitting next to that person, you're saying I still won't get COVID?
At least in our experience here in our campus and, a couple of places where we have this device installed, I think in our experience, none of us wear masks here. We are all sitting close by. We get a lot of visitors to our campus every day, and none of us got infected. So that's what I would say.
If this claim is effective, this is going to be a trailblazing innovation. Let's get Dr. Anil Balani. What do you think, Dr. Balani, about this product, this innovation, which Dr. RajaVijayKumar is talking about?
Yeah, this seems to be a very promising product, but I still have my reservations because in any case, we need a lot of validation before we can really say that this product is effective. Mm-hmm. And I think it would be more relevant when there is a room and we have people sitting and talking to each other. This could definitely prevent that. But as far as sneezing or coughing is concerned, the velocity with which the virus travels is extremely fast and intense. So I'm not sure whether it can prevent that. In a placid room, definitely, where people are talking to each other and at a distance, definitely it can reduce the viral load. But all this, as I said again, this needs validation.
May I ask Dr. Raja then, what kind of validation have you got for this product, Dr. Raja?
Yes, you see, first of all, to answer to doctor's question, we're talking about photon-mediated electron emission, and photons travel the speed of light, and the virus doesn't travel at the speed of light anyway. Coming to the validation, yes, we send this device to the United States because all our labs here were too busy, and so we send this to United States and Mexico. Some of the tests were done in the United States, some of them were done in Mexico. So we have the virology study, actual virology study, and not the bacterial study which we normally extrapolated for viruses. But with a true virology study, the first study was done on a surrogate virus, the equitin arthritis virus, which is again an RNA virus belonging to the same family, same order. And then we had another study done on the capsid, the spine protein itself, on influenza B, virus. Influenza B virus is a precursor to the novel COVID, the present COVID virus, the COV2. So we have done these studies, and these studies have shown that there is substantial reduction in the infectivity of the virus, both from the capsid point of view as well as from the the log reduction.
Yeah. I think this is interesting. So what he's saying, Marzin, is that nobody's making 100% claim, but he's certainly saying, Dr. Raja is saying this is fairly effective, and he seems to have quite a lot of international validation for this. Is it good enough to hit the market? I mean, is this product going to be there? Who is it really aimed at? What are those enclosed spaces where it can be used, Marzin?
So, thanks, Arnab, for that question, and it's a very valid question. To the best of the reports that we have seen, the product eliminates 99.9% of viruses from the coronavirus family. That's the report that we have seen, and therefore, to answer Dr. Balani's question as well, the report shows that it eliminates 99% of bacteria and virus in air, as well as on surfaces. Going back into where the application is, it's very disturbing that a little microorganism like, which is the size of, in logs of, millimeters or, micrometers, is able to hold the entire world to ransom. Today, the whole economy is suffering. People are dying. People are afraid of going out. And there's widespread fear across the world on this. Our goal is to, is to help clean this up a little bit, help the world less of fear, and to build a world which is a better and a safer world. And we've been fighting bacteria and viruses for over 38 years, since the day we were born, whether it's in the water you drink, whether it's in the air you breathe, the bed you sleep on the floor you walk on. And Eureka Forbes is actually, looking at taking this to the next level. We are not stopping the testing. We are still in touch with laboratories in India as well. Unfortunately, the kind of technology that is needed to do this is not readily available, and it's not easily available. And these tests takes a long time. So we are going with the test that the doctor has shown us from Mexico and has shown us from the US. And these are, UL certified laboratories, etc. So there is a reasonable amount of data for us to, and the confidence to go to market with this product. And we're convinced that, this can make a difference. It can help people step out without fear, and, take the next level in opening up the economy.
Yeah.
So it is a product which can be used in restaurants, in stores, in offices, factories, studios like yours, even homes. So that's essentially where we are coming from, and that's the difference that we would like.
Maybe
to
airlines, but you'll have to. The whole problem has been, as we all know, Dr. Kumar, about travel, about interacting with people, about going to restaurants, about going on trains. So being in enclosed spaces, sharing it with others. Who's a carrier, who's not. So obviously this will help, but have you looked at all the risk factors? Are there any risk factors associated with this, Dr. Raja?
No, right now we have assessed, we have tested the device, the technology with all the international standards for safety, safety in use with humans and animals. Safety in use in places where you use other equipments, like the EMI, EMC. We have tested it for the bacteriology. The device does not in any way affect the bacterial growth. Bacteria proliferates, it grows normally, so it doesn't affect the normal flora and fauna which is on your body. So the good bacteria are not destroyed. And the same thing with the fungus. It doesn't affect any funguses. So you still have your, the bread made and your beers made without affecting it. So it is. There are a whole battery of tests to see that we have cleared off from everything possible to make it as safe as possible.
Yeah, well, there's no perfect solution, but in these pre-vaccine times, Dr. Balani, anything like this surely generates interest. And you've been treating COVID patients. What do you think? Is it worth looking at?
Yes, it looks very promising, and it is definitely something, because as of now we are more working to the preventive part.
Yeah.
And in prevention, we mainly had social distancing, we have had masks, we have had hand sanitizers. And today's time, the main issue is why people are not getting back to offices or starting moving out in spite of opening up, is the fear that they will get COVID from somebody else.
Obviously, and even
And
for
this instrument,
for office goers and even for doctors, those who come home, the fear of infecting family members, etc.
Yes, today even in my own clinic, the main fear I have, in spite of wearing everything, that what if somebody coughs into my face inadvertently?
Yeah.
And if I have an instrument like this in my clinic, I'll be at ease.
Yeah.
So similarly, even after opening up, we are noticing that patients are not coming to the OPDs, patients are not moving out, patients are not getting on with meeting people, conducting their businesses, because the fear of catching corona, even in an office or a closed space or wherever.
Yeah, yeah, absolutely. Well,
And even travel is not picking up, I guess, for the same reason.
Well, this is promising,
this looks
and
very
it's at a
promising,
press of a button, so it looks exciting. Well, I wish you all the best,
Exactly. And
Dr.
it's not
Kumar, and thanks to
very
Marzin
tough.
for explaining this. And Dr. Balani, let's see where this technology goes. Technological solutions always welcome. Thanks for that. Thanks for joining me in that last segment. And viewers, to remind you, we are still keeping a very close focus on the Sushant Singh Rajput case. Our investigative leads indicate some new facts. We're still looking at them. And on that and much more, see you tomorrow at 9 for tonight. Good night and goodbye.